So our final speaker and keynote speaker is Dr. Bruce Bekkar. Bruce Bekkar is a women's health physician, speaker, author, and has been engaged with the climate crisis since 2007. He currently serves as a Climate for Health Fellow at Eco America, on the editorial board of the Journal of Climate Change and Health, as a chair emeritus of the Public Health Advisory Council in Southern California. He also co-hosts Green Docs, a podcast for women's health, pregnancy, and environmental threats. In 2020, Dr. Bekkar led the first comprehensive review of climate impacts on births in the United States, published in the Journal of American Medical Association, which has been viewed more than 100,000 times. In addition, this landmark study has been cited 400 times in peer-reviewed research. It is currently referenced in the policy documents from the World Bank and World Health Organization. An internationally sought-after keynote speaker, Bruce has delivered over 100 talks on the perils and possibilities of climate change to diverse audiences, including Genentech, the American Meteorological Society, England's Royal College of OB/GYN, and the United States House of Representatives Democratic Caucus. His recent TED Talks, "The Climate Crisis Isn't Your Fault, but It Is Your Problem," has over 50,000 views and is a call to action for healthcare providers and anyone who wants to help assure a vibrant, healthy, and prosperous futures for all. So please help me in welcoming Dr. Bekkar.
First of all, I have to congratulate you because this has been a long and incredibly dense, full, inspiring day, and I want to acknowledge the organizers, and I really want to acknowledge all of you for making it through. And I feel like my job in the little bit of time that I have with you is to help you maybe make sense of the totality of this information and start to think about where to go next. So that's what I'm going to be doing. I bring you greetings from my home in North Coastal San Diego. It always feels like a bit of a humble brag, but this is the reality. It's a 5-minute walk from my little townhouse, and it's paradise. And this spot has really everything to do with why I do climate work, because when I initially had my moment of awakening in late 2006, it first of all for me was about my concerns about the coastline that I love. I'm a very enthusiastic but very amateur surfer, so this is my home. This slide is also meant to remind me to tell you that I have no significant disclosures, no conflicts of interest. Regarding artificial intelligence, AI was not used nor harmed in the making of this presentation, and any bad jokes, omissions, and errors are the fault of the presenter and no one else. So let's get into this, and I really do want to make the point that I think it's very significant that you have all attended today and that you have attended the entire day. It's tough to sit through a full day's worth of lectures, particularly some that have the kind of information that you got today. I suspect most of you came to this already understanding, at least at a very gut level, how serious this crisis is that we're facing. But I'm not sure that that really leads us to a solution, just having all that information. I think we need a little bit more. And to get into that, I'm going to ask you a question. A little bit out of left field, and I want an honest answer from all of you. How many of you smoke tobacco products?
Did or have?
Either one. All right, so we have a couple of honest people in the room. Good. And not a lot of hands went up, right? And that's not surprising. And so, if I'd asked that question of a similar group of doctors back in 1965, how many hands do you think would have gone up in response to that question? At least half of the room, maybe 3/4 of the room. So something changed, and the question is, what was it? And in order to get to that answer, I'm going to give you a little bit of Bekkar family history. Back in 1965, we had an impromptu vacation. My parents took my sister and I to San Diego, down from Los Angeles, for a couple of days vacation. And I was excited because we'd never been to San Diego. My mom warned me and my sister, she said, "You got to be kind of careful around your dad this weekend. He might be kind of cranky. He's decided to quit smoking." And my father had decided to quit smoking because The Surgeon General's report had just been released that for the very first time linked smoking to heart disease, lung disease, and premature death. And my dad being an aerospace engineer, that was enough for him. So he was going to quit, and he wanted to go away for a couple days to be distracted because he thought it would make it easier for him to stop. Anyway, he was far from alone. That Surgeon General's report was incredibly impactful. It empowered doctors all over the country and probably around the world to really help to motivate people to quit this incredibly toxic habit. And so it was really, really important. And over the course of the last several decades, it saved, nobody knows, but obviously countless lives were saved by that Surgeon General's report. It was a big turning point, and it has everything to do with the fact that when I asked that question a few minutes ago, how many of you use tobacco products, so few hands went up. Things really, really changed. But if we go to the present, I think it's, particularly to this audience, after what you've heard today, we have an unofficial Surgeon General's report out about the dangers of climate change to human health. There's an incredibly big and growing body of peer-reviewed evidence around the health harms of climate change, literally across the spectrum of specialties. This special edition of our journal that was put out a few months ago is a collection of articles from lots of specialties you might not have guessed, like ophthalmology and neurology, orthopedics, surgery, emergency medicine, detailing the harm that's coming to patients that these clinicians see. Our own article in JAMA back in June of 2020 was the first large-scale review of birth impacts tied to climate change. Preterm birth, low birth weight, stillbirth, we've heard a fair amount about that already today because it's really filtered out into the literature. I could spend all of my time up here today telling you about all the studies that have come out since ours has come out that have validated our findings and expanded upon them. And so we have this tremendous volume of knowledge that's growing about the health harms of climate change. But it's kind of odd because despite having this mountain of evidence, this really clear-cut evidence that climate change is hurting our health right now, and the ready availability of alternatives, we are collectively still smoking. We are still burning tons and tons of fossil fuels every single day, which is kind of odd, right? And I don't know exactly what prompted me to think about this, but I started thinking about AI, probably in part because we hear about it constantly. AI has gotten trillion-dollar valuations because it has this capacity to marry the world's knowledge with computers that are as smart as we are or even smarter and really transform how productive we are and how we live our lives. But the problem with AI is it doesn't get it right all the time. You might have heard that AI sometimes makes stuff up. It actually is not all that infrequent. These are called AI hallucinations. And I would imagine most of you have been hearing about this problem. It's important because if you rely on AI and you don't know that it's lying to you, you can delay necessary actions, you can stop doing something that might be helping you. It can cause a lot of harm. And so I started thinking, and again, I'm not exactly sure why I was thinking about it, but I started thinking, why does AI hallucinate? Is there anything to be learned from that? So of course, in order to find out why AI hallucinates, I asked AI. Uh-oh. We have a tech emergency, but I'm going to keep talking. So I asked Apple Intelligence why AI hallucinates. So the reason it does, according to Apple Intelligence, are for three reasons. Thank you. Limitations in training data, biases, and a reliance on predicting patterns instead of understanding reality. Does that sound familiar in the context of what we've been talking about? It should, because I think it's exactly the same reasons. I think we're in the midst of essentially a hallucination about the climate crisis in our society. Again, distorted inputs, also known as misinformation, biases, and we're stuck in patterns of behavior, also known as habits. There's this inertia that comes from just we're used to doing things a certain way. And so I think the combination of those things leads us to not react to climate change. But here's where it breaks, that analogy to smoking breaks down. Because if you know about the health harms of smoking, but you continue to do it, you're primarily hurting yourself. If we continue to burn fossil fuels the way that we are, we're hurting everybody. And not just our species. We are harming species all around the world, ones that we can't see and ones that are so big they're frightening. They're all in unfortunately, in harm's way because of this habit that we have. And what it's getting to, as you've gotten a sense hearing about this today, we've been talking about the health issues, but you know about extreme weather events, you know about all the other health harms. Nature is virtually breaking down around us. And one way that I think about it, I use a lot of medical analogies, is we shouldn't think of climate change as a manageable illness. We shouldn't think of it as a diabetes or emphysema, where if we just change a few things in our routine and adjust how we do things, everything's going to be okay. I think the best analogy for climate change in the health field is it's more like a cancer. If we don't stop it, if we don't stop this habit and cure this illness, it's going to continue to get worse to the point where it's going to take everything away from us that we want out of life. That's simply the reality. There is good news coming. Don't lose hope. What can we do? Well, somebody mentioned this in one of the talks earlier today. I don't know about you guys, but when I think about this, I'm afraid. This is frightening. And that's not as I think it was Elizabeth Pinsky who said it, that's a normal reaction to this reality. So it is a frightening thing to confront this climate crisis that we have in front of us. And fear does different things to different people. We see a lot of people out at talking heads in the media who, instead of dealing with climate change, they just want to get angry about it. They stay in denial and they're angry. And there are two problems with that. First of all, if you're angry, you're not solving anything. And secondly, if you're angry, it's impossible to feel joy. You actually pay a huge cost. And again, another medical analogy I keep coming back to, you know how sensory nerves can't carry pain and pressure simultaneously? You cannot be angry and have joy in your life at the same time. So there's a big price to be paid for that. For a lot of people, they get paralyzed by their fear. They don't react at all. They are unfortunately just stuck trying to ignore it, but there's a cost to that too. Because every single time you get reminded of the climate crisis, which I would assert happens more and more often every year, it takes energy away from you in order to suppress your anxiety and your fear about it. So it's costing you energy to try to suppress that feeling. There is only one way to engage with this problem, and unfortunately, you now all know too much to pretend you don't know about it. And that is to engage with it. If you embrace the climate crisis, if you start to find some agency in dealing with this problem, it'll do two things. First of all, you will find instead of it taking energy away from you, you will start to get energy from it, and you will start to find hope. And I know that that's hard to think of right now, but I guarantee you, if you talk to anybody who does climate work and health, it lights them up. It makes them smile a lot, like Ethan's smiling all the time today with this conference that he's helped to create. So, talking about finding your voice, finding agency, for a lot of people, they think that climate action means stuff that they can do on a personal level. And so they recycle more, and every time they go to Whole Foods, they bring a bag. And they think they're climate warriors because they do that. But if we want to get a little bit beyond the bag, the Union of Concerned Scientists told us more than 10 years ago that what you eat and how you get around, your transportation choices, are your two most powerful things that you can do as an individual to lower your own personal footprint. And to that I would add, because of the technology that's come along lately with solar panels and batteries, how you power your home life is also a very important thing you can do. But there are real limitations to this. First of all, I don't think people should get wrapped up in trying to be perfect about their carbon footprint. Somebody mentioned that in a lecture earlier today. First of all, you can't be perfect. But second of all, the other point I want to make about it, even before I go on to the last one, is that these things are not sacrifices. So many times the way we talk about these things, we're talking about them like, oh, if you just make this change and you get an EV, or if you stop eating so much meat, or if you buy solar panels or something like that. Every single one of the changes that we're asked to make, or that we ask ourselves to make, will actually add to the quality of our lives. I've been driving an EV for 12 years. That's my Polestar 3. I just got rid of my Tesla 2 weeks ago. I love it. I love driving electric cars. I have an induction cooktop that I can boil water for pasta in 2 minutes instead of 8 minutes. These things all make your life better, so they're not sacrifices. But the third reason I think we shouldn't be focused too much on our personal actions is because they're insufficient. If all of us in this room and everybody we know and everybody they know zeroed out their carbon footprint, we would still have a climate crisis. We need large-scale, rapid social change, and all that really matters, really, is how fast we get there and what you and I can do about it. And I did say something about good news a few minutes ago. The good news is, and you've heard this mentioned a couple of times today, that you are in an ideal position to help make that change happen quickly because of who you are in society. Now, there are a couple of directions people go in when they engage in, as healthcare professionals with the climate crisis, either to lower the environmental footprint of healthcare or to engage in what's called advocacy with patients and peers and the public. But before I talk about those in a little bit more detail, I want to mention that the two things that keep people from getting started, I think, that I've heard of for years now are, can I make a difference, because I'm already kind of busy, and how do I start? Well, as far as making a difference, and I think you've also heard this a bit earlier today, who you are in society, polling still shows you are amongst the most trusted voices in society. So even if you just go to a Sierra Club meeting and sit in the back, and people know you're a physician or a PA or you're in healthcare, it makes a very significant difference. If you show up at a city council meeting and you wear your white coat and you speak for a minute or two about childhood asthma and building electrification, it makes a real difference. And I'll give you another example of that in a moment. And as far as how you start, one of the recommendations that was given earlier, and I've heard it before, is to look at the intersection of what's needed, what you're good at, and what you enjoy doing. That's one way to look at it. But the other thing is, there are options open to you all over if you just show up, if you're just willing to go and try something, go to a meeting, go join the local green team or something like that. If we're talking specifically about sustainability in healthcare and lowering the carbon footprint of healthcare, you heard earlier about Healthcare Without Harm and Practice Green Health, the Clean Med meeting. These organizations nationally help coordinate efforts that people are making at their hospitals and clinics, and also share resources and best practices. Todd Sachs' My Green Doctor is a software-based program that helps you change your practice's carbon footprint and also save money. But there's probably a green team at your hospital, and I guarantee you that they would love to hear from you. As far as the advocacy work, that can be kind of a scary word for physicians and other people in healthcare because we have no training at all in whatever this crazy thing is, advocacy. But I'll tell you something, you are already doing some of the work of a climate advocate or a climate activist, even if you're not aware of it. Because every time you encourage patients to eat less meat and eat more vegetables, to walk and bike more and drive less, every time you speed up the healing of an injury or the curing of an illness, every time you do that and reduce resource needs of a patient, that is climate activist work. But in order to take that to the next level, we heard about the Medical Society Consortium on Climate and Health. I strongly advise you to look these people up. They are the parent organization for, I think, the parent nonprofit that is hosting this meeting. And I'm also a big fan of Eco America's two programs, the Climate for Health program and Climate RX. And we actually have Climate RX badges, which we're going to be able to give away to you at the back table at the end of today. The Climate for Health program, just in case you're interested, they have an ambassador program, which is a 4-hour training that you can do that's virtual, and you can do it on your own time. It provides CME credit, and it has information on climate and health, but also on advocacy. It's really good on communication training. You know, how to write an op-ed, how to conduct yourself at a city council meeting. And there's a network of healthcare professionals that you join when you take that training, and again, it's all free. I think, and I'm not sure I've heard this yet today, but I think we also have a problem which needs to be addressed in light of climate change, and that's what I call the waiting room problem. And the analogy that I use to explain this to people, this is kind of my own thinking, is that if you ask a kid in the upscale beach neighborhood where I live in San Diego where tomatoes come from, he just looks at you funny and says, Whole Foods. Because he doesn't get that there's a backstory to that fruit and how it got to Whole Foods, whether it was sprayed with pesticides or insecticides, how far it had to travel in a refrigerated truck. And those things all make a difference in terms of how well the food tastes and how safe it is for you to eat it. So the backstory is important. I think in medicine, we've always been blind to the backstory of our patients environmentally. We don't screen them for their environmental exposures by and large. We kind of come to them when we see them in the emergency room, and we find out that they live in an urban heat island, or they live near a factory, or they can't afford to use their air conditioning. So I think one of the changes we need to make in healthcare is we need to start integrating patients' environmental exposures into their care plans. And there are ways to do this that don't necessarily mean more time from the provider on the front line. This can actually be screened for and by ancillary staff, and there's a really good TED Talk about that I can tell you about if you're interested. But anyway, I think we have to start, given how much impact environment is having more and more on patients, we need to pay more attention to it. And then I want to just tell you an example of some kind of out-of-the-box work we've done in San Diego to form what is called the Public Health Advisory Council. About 5 years ago, the head of a potent climate nonprofit in San Diego came to me and said we should elevate the health voice with elected officials. They need to hear the health messaging more than they're hearing it, because it'll help them do the right thing. And so we put out word and started collecting docs that were interested, and within 6 months we had 8 doctors who were meeting every month and giving them some education, and pretty soon we started going to city council meetings. And this nonprofit used us and continues to in a very surgical way. They picked very specific council meetings at specific dates and times when certain issues were going to come up where they thought the health voice would really help, because doctors don't have a lot of time to go and do this work. And what I really want to get across is that when you have 3 or 4 doctors come in and testify at a city council meeting wearing their white coats and speaking, again, not about climate science, but about the real world health impacts of the decisions that these elected officials are about to make, and how that's going to affect not only the health and well-being of their constituents, but also the local economy, they listen. And we've been in some very, very red counties in San Diego, or cities in San Diego, and there are some, and they are, I've just been impressed that no matter how we thought we'd be received, we've always been received very respectfully and shockingly well, getting votes that we never thought we'd get. Because if you give them an excuse to do the right thing and they really kind of know they have to do it anyway, they'll oftentimes come along. So I just share those examples as things to think about as we move forward in making progress. Okay, so I got to pull some inspiring quotes out. One of my favorites is from Al Gore, and I think it just points to the moment that we're in. He said we have to adapt to what we can no longer prevent, but we have to prevent what we cannot adapt to. There's a limit to how many adaptations. We shouldn't get seduced by the idea that we can adapt our way out of this. Another thing is something that I said at one of our Public Health Advisory Council meetings, and it's about thinking big, because we need rapid social change, and the only way we get there is by taking some pretty big swings. So what I said to them was, never hesitate to ask anybody for anything if it's for the good of everyone. And this work is for the good of everyone, whether they like us, whether they agree with us. It's for people that don't have a voice. It's for everyone. And the third is from Mark Twain, and this is one of my dad's favorite quotes, and I've adopted it because it fits. And he said, if you're going to tell people the truth, you better make them laugh or they'll kill you. We have to remember, and it's so easy when you contemplate this moment that we're in, to get weighed down by it, to be serious and to get lost in the fear. And we have to remember that that doesn't work. It takes energy away from us. And you want to be the kind of people, when you're doing this work, that somebody wants to show up and hang out with, and go to a long meeting with, and write a paper with, or go to a council meeting with. So we have to remember to find the joy in this, to share the joy in this, to underline the victories that we have, and not mis-celebrating them. And we have to just lighten up. You're not going to be perfect about having a zero carbon footprint, and it's not us versus them. I really believe that the truth is that the great majority of people, the polling shows it more and more now, people get it. They know that we need to do this. We're stuck in our habits. We have a lot of inertia around doing things a certain way. But there is great joy in making changes that help ourselves and others, particularly others we'll never meet. And so let's keep that in mind. It's time to expand the Hippocratic Oath to include the health of nature as well. As it was introduced, the title of my TED Talk, whether you like it or not, whether you think it's your fault or not, the climate crisis is your problem. And so we have to keep it in mind. And I'll bring you back to what I mentioned about my family in 1965 and going to San Diego. Surprise, surprise, I ended up moving there and having my whole career there, and I love San Diego, and it's part of why I do the work that I do. Another part of it is my dad. He's a big inspiration of mine. And I don't have kids of my own, so I guess the babies that I've delivered over the years are my reason, because I want them to have a world to grow up in that is at least as good as mine. I feel like I owe them that. And so that's why I do this work. And it also makes me feel a heck of a lot better than trying to ignore it and just hoping somebody else fixes it. So I ask you to think about not just learning about climate change, but to engage with it. It will give you more than you put into it. It will return that energy and more. It's absolutely vital. You have a key role to play. And I really hope you'll join us, starting now. Thank you. And I'm certainly happy to answer any questions, but I also want to tell you that this QR code is there so that you can actually pick your phone up and point it at the screen before you get up out of your chairs, because it's all about what we do now, and that will take you to the Idaho Clinicians for Climate and Health. And I think Amanda's going to come up in a moment and tell us a bit more about the organization and other opportunities you have here locally. So let's make today count. Anyone have any questions or comments, or we can just hang out afterwards?